Everyone, this is Saro Arakinas, your clinical pharmacist. Welcome to another episode of Pharmacy Talk USA. So many of you guys asked about renal failure medications and those medications that can work and protect patients in renal failure. And I want to give you a summary of these medications. So first of all, stop the medications. If you're having a dialysis patient, aspirin may be also given to stop the dialysis access becoming blocked. So there are medications that, as you see over here, the medications that can help with stopping the access being blocked, such as aspirin. In some cases, you may be given a similar antiplatelet tablet, such as clopidogrel or Plavix or dipyridamole. So these are a few options that you can be given as a patient going through dialysis to stop the access being blocked for the dialysis. Then how about stopping itching during dialysis? So itching can occur in kidney failure patients because of toxins building up in the body. Creams and ointments are used keeping your skin moisturized and cool, and that can help with itching. Creams that often contain cooling ingredients such as menthol can work for some patients. Then we have gabapentin and pregabalin over here, as I mentioned. These medications work by affecting your nerve endings in your skin. This can help to stop itching. Then we have the antihistamines, which such as chlorpheniramine belongs to in a group of medicines called antihistamines, and this could help with itching that occurs in these patients. We have phosphate binders. High levels of phosphates in the blood can lead to itching. We can reduce the levels of phosphate levels in the blood for these patients by using phosphate binders. Then we have stomach protective medications, lansoprazole and omeprazole, reduce the amount of acid in the stomach. They can help with indigestion, heartburn, or problems with the stomach ulcers. We have stomach slowing kidney disease medications that can help with slowing the disease, such as SGLT2 inhibitors, such as dapagliflozin, along with other drugs called finerenone, may be used to try slow down the decline of the kidney function and its decline. Your kidney doctor, nephrologist, we'll look at a specific of the case for each patient and make sure to these medications are proper medications for that specific patient. We have the replacing of vitamins. If you're on dialysis, you may need to replace these vitamins with combination tablets such as Ketovite, Dalavit, or Renavit. So that's important for patients to monitor their vitamin levels. Some medications that can help removing the acid in the blood, sodium bicarbonate capsules for treatment of anemic patients, especially that can increase their levels in the blood count. Anemia that is experienced by these patients going through kidney failure, giving erythropoiesis stimulating agents such as Retacrit or Ironest can help with anemic patients. Iron tablets can be used to treat anemia. So again, it's given to these patients through kidney failure. Phosphate binders for high phosphate in the kidney levels, such as I mentioned, Renagel or Remvela, which is the other name is Sevelamer, or also Velphoro, which is sucroferric oxyhydroxyate. So these are phosphate binders, as I mentioned on the top section. And lastly, as I mentioned, vitamin D for vitamin D deficiency. So here are some medications, a summary of them that could be used for, especially for kidney failure patients, and those that can stop the access of dialysis to be blocked, such as aspirin, clopidogrel, some medications that can stop the itching, phosphate binders, stomach protective medications, medications that slow the kidney disease, such as SGLT2s and finerenone. Replacing vitamins is important. Removing the acid in the blood is important. Anemia and iron deficiency is very important to address in these patients. And lastly, phosphate binders and vitamin D are crucial medications for these patients to be on, specifically if the provider and nephrologist is appropriate. For more detailed information on these medications, make sure to comment on the video with your questions, and I'll be happy to answer any more questions you may have on patient medications for renal failure protection and treatment. Hope you enjoyed this video. As always, stay safe and take your medications.